When we think of the most deadly diseases in human history, those with serious and frightening visual symptoms may portray us as the headlines for their rapid spread and many victims. On the contrary, many of the most deadly diseases described do not kill as many people as we think, nor do they rank even among the top 10 causes of deaths in the world. It turns out that the most deadly diseases are those that are slowly escalating. Of the 56.4 million deaths in 2015, 68% of deaths were associated with long-term chronic diseases. In contrast to rapidly spreading diseases with severe consequences, lethal diseases that develop slowly and try to control can be monitored. Through the correct diagnosis, preventive care and advice provided by healthcare personnel, patients can take steps to reduce the risk of the consequences of their critical health condition. Coronary artery disease. One of the deadliest human diseases is coronary artery disease, also known as ischemic heart disease. The disease is caused by a narrowing of the blood vessels due to damage, and the patient is at risk of heart disease. Symptoms of the disease include arrhythmias, chest pain and heart muscle failure. Fortunately, due to improved science, medical care, and education, death rates from coronary artery disease have declined, although he remains the #1 killer. Coronary artery disease can be overcome by maintaining a lifestyle that maintains a healthy heart. Brain attack. A stroke occurs when an artery blockage in the brain occurs or blood leaks from it. Your brain will be deprived of oxygen and cells will begin to die within minutes. Symptoms of a brain stroke include numbness of the extremities of the body, difficulty walking or vision, and general confusion. Strokes can be recovered, but if left untreated they can cause long-term disability. But according to the U.S. Centers for Disease Control and Prevention, while 93% of people know that sudden numbness is a sign of stroke, only 38% are aware of other symptoms. Consequently, stroke is the leading cause of long-term disabilities. Lower respiratory infection. Flu, bronchitis, tuberculosis and pneumonia are sources of infection in your lungs. Viruses and bacteria enter the bronchial tubes, causing major symptoms such as coughing, shortness of breath, or chest tightness and wheezing. Left untreated, lower respiratory infections can lead to death. If you get an infection, stay home as much as possible to give yourself a chance to rest and remove the infection faster, as well as to avoid infecting others. COPD. This condition makes breathing difficult in the long run. Emphysema and chronic bronchitis are the most common types of COPD. In 2004, an estimated 64 million people living with lung disease were registered. Respiratory cancers. This disease includes cancers of the trachea, lungs and throat. Factors that lead to the development of this type of cancer include passive smoking, toxic particles, smoking, mildew at